Let's say you want to study what are the risk factors that cause Parkinson's disease. At your center where you are working, you don't often see cases of Parkinson's disease. Let's assume sometimes in a month you see one case, sometimes in 2 months you see one case. So it is not that common at the place where you are working. But you are interested in identifying the risk factors related to Parkinson's disease. So, which type of study do you think will be good in your setup to study the risk factors? Will it be good to do prospective cohort study? Prospective cohort study means you do not select the cases that has already Parkinson's disease. You select some patients, like you have 500 patients that come in your follow-up regularly, and you take all those 5 cases and follow them forward for 20 years, 30 years, 50 years and assess who developed Parkinson's disease. You will be able to do that? Sometimes you may change your job, you will go to another places, you might not be able to follow that long, right? So following for 20 years, 50 years, those cases, I don't think it is suitable study, right? So what about retrospective cohort study? Retrospective means you go back in time, like you assessed all the medical records from 20 years back or 30 years back, and from there you choose 500 medical records and you tracked all those 500 patients who has developed Parkinson's disease. So here also you are going from cause to effect. You are not going from effect to cause. You went in past 20 years back and you assessed 500 medical records of 500 patients, and you are now tracking for 20 years in the forward. So you are doing that study in the back, in the past, but you are coming from more past to past. You are still going from cause to effect. You are not going from effect to cause. You are not choosing Parkinson's cases and assessing risk factors, right? You have collected 500 patients, 500 medical records, and you are tracking them who developed Parkinson's disease during the 20-year time period. So you have that good medical record. Yes, obviously you can do that, but you may not have a record. So in that case, what will you do? So as I told you earlier that you see 1 cases or 2 cases or sometimes 1 case in 2 months. So what you can do, that you select all the cases of Parkinson's disease. Like in a year you see 20 cases, let's say. So your cases are 20 cases of Parkinson's disease, and you ask those all cases, what are your risk factors? Do you smoke? Do you consume alcohol? Have you been working in some metal industry for 5-year duration? Do you have history of Parkinson's disease? Right? So whatever you have list of risk factors, you ask the cases. So if you do like that, you can assess the risk factors, right? So do you smoke? You ask to all Parkinson's disease. Do you consume alcohol? Have you worked in metal industry for 5 years? Yes, no, yes, no, yes. So smoking does not mean Parkinson's disease. Smoking does not always cause Parkinson's disease. There might be many non-smokers or many smokers who have developed Parkinson's disease. That's why you have to also take control, right? So you do not only assess cases, you also take some controls. So you take control as who do not have disease. You do not have Parkinson's disease. So you have taken 20 cases of Parkinson's disease. So you also take 20 controls who do not have Parkinson's disease, and who are similar in demographics to your cases, who have similar comorbidities, similar gender profile, similar age, living in same environment, working in similar environment. So you try to match all those characteristics similar to your cases, right? Except your controls do not have disease, do not have Parkinson's disease, but rest everything, exposure status, other characteristics similar. So you also assess words of exposure among controls, and you calculate words of exposure among your cases. And if you divide words of exposure among cases to words of exposure among control, you get an estimate of relative risk, that is called words ratio. So it is actually not risk ratio, but we call it words ratio. We use the term risk ratio in cohort studies. But do you know why don't we use risk ratio in case control studies? Why can't we use the term, the risk ratio? Almost it is similar. So here in this example I told you that you take one case and one control, but you can also do that you can take 2 controls for one case, 3 control for one case, 4 control for one case. So if you have a small cases, generally they tell to take at least 4 controls for each case. So as much control you take for each case, that much good your study will be. But it's very difficult, or can be difficult, to find so many controls, because you cannot take any control, any population. You have to match with cases, right? Similar age, similar comorbidities, similar locality where they are living, similar occupational exposure. So it becomes like difficult, but try to take at least 4 controls for each case, because as much controls you take, you can estimate, you can approximate towards the risk ratio. For one case to one control, you cannot approximate to risk ratio. You can calculate that with formula, and you can check yourself. As much controls you have, you go towards approximate risk ratio, right? So as I told earlier, you take controls who do not have disease, but in almost try to match all characteristics similar to cases. And here sometimes it becomes problem, because you may not find similar characteristics as cases, and their selection bias occurs. That's why if you see in evidence pyramid, case control is in lower down. So even if it is lower than cohort studies, because of this selection biases that you cannot avoid completely, right? But for rare disease we have to do that, because what will you do if you don't do case control study, right? You have to see everything. You have to see your budget, you have to see how long you can follow up the patient. If other study, high quality study is not feasible, you have to do case control study. So in rare cases, in disease which are generally rare, which you cannot follow up for long period of time, in that cases we do case control study.